A child dealing with obesity can suffer more than just the physical hardships. Medical Director Jeffrey Kluver with the Behavioral Health Program at Trident Health says it also plays a role on their mental health and behavior.
The behavioral impacts on a child who is overweight can include things such as being picked on or bullied at school.
This could make kids less likely to engage in activities with other kids. Dr. Kluver warns that makes it harder for them to lead a healthier lifestyle.
There's also implications such as anxiety, depression, and other things that can be symptoms or lead to full-blown disorders that have a high comorbidity with being overweight.
Dr. Kluver says from a parent's perspective, it's a balancing act.
But also instilling in them an interest in being healthy, being physically active, eating healthy, getting enough sleep, and doing all these things that are good for us that can limit the rates of obesity.
But he says don't put too much attention on body weight and shapes. This can create stress or anxiety as well. Focus on the health part, being active and eating well, because that's what's good for the body and the brain.
It's always interesting to think about in a society where we're inundated with messages about how we should look, that we're also dealing with higher rates of obesity than we ever have before, and then more so than most countries do.
Dr. Kluver says if your kid becomes more anxious, this could cause them to engage in unhealthy behaviors to help cope, which Kluver says in turn becomes a downward spiral. Instead, Kluver suggests attacking the problem head-on and addressing the issue. Olivia Parsons, Count on 2.